Come in.
Hi, I'm Hannah. I'm the intern pharmacist. And you are?
I'm Oscar Sanchez.
Nice to meet you, Mr. Sanchez. So it looks like you're going to be discharged today from your admission for chest pain. I just wanted to go over all the medications you'll be discharged on. Is that all right with you?
Yeah, sure.
Okay. Can you verify your date of birth for me?
It's August 31st, 1959.
Okay, perfect. And do you have any allergies I should know about?
To Motrin. I had a bleeding incident in the past from taking it.
Okay. We'll be avoiding Motrin then. The first medication that the doctor wants for you is the Protonix. It's also called pantoprazole. This one you're going to take twice a day, and it's 1 tablet twice a day. So usually people take it 30 minutes before a meal. Is there any meal that you eat regularly every day?
I do eat breakfast and dinner pretty regularly.
Breakfast and dinner? Perfect. So you can take 1 pill 30 minutes before breakfast, and then your second pill 30 minutes before dinner in that case. So this medication is going to help with the GERD that caused your chest pain. So you should probably monitor for improvements in your symptoms of heartburn or acid reflux. It should help with that. Some adverse effects you might experience from the medication, however, would be some diarrhea, abdominal pain, and headache as well. These are pretty common with the medication, but if they do become severe and start interfering with your daily life, you can always ask the doctor to switch the medication in that case. And aside from taking the medication, some things you can do to help with your GERD is weight management, incorporating some exercise into your lifestyle, as well as elevating your head when you're sleeping and avoiding any spicy food and avoid eating too fast. For this, you'll want to follow up with the doctor in 2 months just to reassess the efficacy of the drug and the treatment for your GERD. So, Mr. Sanchez, how will you be taking this medication?
You said twice a day, so 30 minutes before breakfast and 30 minutes before dinner.
Perfect. And when will you be following up with the doctor for your GERD?
In 2 months.
Perfect. And the next medication the doctor is going to discharge you is on the atenolol, 25 milligrams. You're going to be taking this 1 tablet once a day, and this is going to replace your Procardia. So you're not going to be taking the Procardia anymore, and you're going to start the atenolol. The reason is atenolol is going to be cheaper for you to buy, and it will treat your hypertension as well. Some of the side effects you want to watch out for with atenolol is some dizziness, and some fatigue and maybe cold extremities, like cold feet, cold hands. To help with this, after you take it, just make sure you get up slowly so that you don't get too dizzy and fall or anything like that. So how will you be taking the atenolol?
Once daily.
And what kind of side effects do you want to look out for with this medication?
Dizziness, so when I'll be getting up slowly.
Perfect. So the second hypertension medicine that we're going to be discharging you on is called hydrochlorothiazide. It's 25 milligrams once a day, so it's 1 tablet once a day. You'll want to take this in the morning because it's a diuretic. It'll help with your hypertension by getting a lot of the fluids out of your body. So taking in the morning will prevent any nighttime urination. Some of the side effects you want to watch out with the hydrochlorothiazide is dizziness, again, like the atenolol. And again, to help with that, just get up slowly after you take the medication. When will you be taking the hydrochlorothiazide?
Once in the morning.
Great. So the third medication for hypertension that you're going to be discharged on is the lisinopril 40 milligrams. This is the same medication you've been taking before for your hypertension. So this is still going to be 1 tablet once daily. And some of the side effects you want to watch out for with lisinopril is a dry cough or angioedema, which is basically swelling of your face. So if you start to see any of these symptoms, definitely contact your doctor and ask for alternative medication. For all 3 of the blood pressure medications, you'll want to monitor your blood pressure daily using like an at-home blood pressure machine. And also, aside from taking medications to help with your hypertension, always keep in mind a healthy diet such as a DASH diet, limiting your salt intake, incorporating some exercise into your daily routine, and also considering smoking cessation. For all of your hypertension medications, again, you'll want to follow up with your doctor in 1 week. So how will you be taking the lisinopril?
Once daily.
Perfect. And what kind of side effects do you want to watch out for?
Usually dry cough and then just swelling of the face.
And when will you be following up with your doctor for all of the hypertension medication?
About 1 week.
Perfect. The next medication that we're going to be discharging you on is Lipitor, 40 milligrams. You've been taking Lipitor before, but we increased your dose from 10 milligrams to 40 milligrams, just because your LDL is pretty high, so the increase in dose will help reduce it by about 50%. You're going to want to take this one tablet once a day, preferably at nighttime, since that's when your body's making cholesterol. And some of the side effects that come with Lipitor would be brown urine and muscle pain, usually in the larger muscle groups such as your thighs, and it would occur on both sides of your thigh. If you experience any of these symptoms, definitely let your doctor know so that we can change the medication for you if needed. Aside from taking the medication to help with your cholesterol, healthy diet, increasing your exercise in your lifestyle, and also smoking cessation would help with the cholesterol. And for this, you'll want to follow up with the doctor in 4 to 12 weeks just to assess your lipids. How will you be taking the Lipitor?
You said once daily at bedtime.
And what kind of symptoms do you want to watch out for?
Muscle pain and then brown urine.
Perfect. So the last medication we're going to be discharging you on is the lidocaine patch. It's a 5% patch. You'll apply it one patch once a day, and you can keep on the patch for a maximum of 12 hours. So you put it on your back for 12 hours, and after you apply it, make sure to wash your hands and avoid touching your eyes, since some of the medication can rub off on your fingers. And this should help with your back pain, since it's not being controlled by your over-the-counter medications. While you're taking the patch, make sure you avoid any ibuprofen or naproxen. Just use the patch for your pain. Besides the patch to help with your pain, you can try considering physical therapy or exercise, and make sure to follow up with your doctor for your pain as soon as you see him. So whenever you follow up with him for the hypertension, you can also ask him about the back pain as well. So how will you be using the patch?
I'll be applying it to my back where it hurts for 12 hours at a time, and then wash my hands afterwards.
Great. So that's all the medications we'll be discharging you on today. What are your questions for me?
I have none. You've been very thorough. Thank you.
No problem. Well, if you have any questions later on, you can always reach us at the pharmacy. Other than that, don't forget to follow up with your doctor, and it was nice meeting you.
Nice
Hope
meeting
everything
you.
goes well.
Thanks.
Go.
All right, well, that's all the medications we'll be discharging you on. What are your